That's amazing. I love that perspective. Very well said.
Yeah.
Thank you. What would you say? I know you mentioned some tech and some of the different, whether it's regulations and policies that are influencing the near future, say 1 to 3 years right now, and we're amidst that time frame right now, and some of these policy objectives and goals. But what do you also foresee that has to change, say in the next 5 years? When you say kind of slow adoption, and obviously we're all rooted in patient outcomes, what really has to change?
What really has to change? That's an interesting, I think let's see here. I mean, I think the biggest proponent probably right now is the adoption of artificial intelligence in some way in your practice, right? And so I think the adoption of that and understanding how to utilize that, everyone talks about AI and very abstract concepts, so like, oh, AI is going to take over or something like that. But it's not necessarily the case, right? What is AI, right? You have to kind of define it, right? So is AI a generative platform like Open Evidence, which combs through medical literature and kind of gets you answers like for us as physicians? Is it predictive like the company I work with, DeLorean AI? Is it like
Mm,
predictive? Does it help you predict certain outcomes like fluid overload or hospitalization or bad anemia results? Or just bad outcomes in general. Or is it like what they call a convoluted neural network, which is imaging, right? So it recognizes imaging. So I think the adoption of those kind of technologies could help us very much, as far as augmenting our care, right? I've heard this argument that artificial intelligence shouldn't be thought of as artificial intelligence, should be thought of as augmented intelligence, meaning
mhm,
as a physician, it augments your care, it makes you a little
mm,
bit better.
mm.
There's so many, I mean, I can go into the problems of healthcare like crazy if you want to get into that. But adoption of that will be kind of crucial because you don't want to be left behind as a practice or a field, right? You don't
Mhm.
want to, if everyone else is adopting, say, artificial intelligence to some degree, and you're not doing it as a field, you may be missing out. And that could be something like for a predictive platform, is it identifying someone who's at risk for CKD progression a little bit earlier,
Mm,
getting them
that's
on the
true.
medications? Is it identifying someone that could be a good candidate for home dialysis that maybe you missed? Do you see what I'm
Mm,
saying? So like,
mhm.
there's all these kind of things there that you don't want to miss out on and not have a good result from it.